Nigel, let's start with you. There seems to have been a bit of a rift today between the Chancellor and the Health Secretary over testing and potentially surveillance and the cost versus, I suppose, the benefit. Nigel, what do you make of this rift and what do you think the expected outcome might be?
Well, it was quite extraordinary that the cabinet was delayed this morning, even as ministers were arriving for the meeting. You can understand why the Chancellor is balking at the idea of keeping tests going. We're giving them out at the moment at the rate of about 22 million a week, and that's costing the Chancellor a couple of billion a month. So obviously he doesn't want to carry on doing this. However, if you're going to get rid of the rule that says we've got to self-isolate having had a positive test, you still therefore need testing around. So it's the best way of discovering if we've got variants coming in. There are suggestions this afternoon that the ONS infection survey, which is very important for that, might be slimmed down, that community PCR testing might also be reduced. Now, all of that will stop us seeing variants coming into the country. And if people can't have their free tests, you're going to get a two-tier system where the rich will know that they've got COVID, and those on low incomes won't. And that's why it's so important. Now, we'll know at 4:30 when the Prime Minister stands up who won this particular argument, and whether or not Sajid Javid got the money from the Chancellor that he needs to keep this going.
Well, let's turn this to Connor Tomlinson now. Are we at risk of creating a two-tier society here, where the rich will know they've got COVID and the poor won't?
I don't think so at all. The idea that we can stop variants coming into the country hasn't happened over the course of the pandemic, of course, because by the time that one country has sequenced it, it turns out months back, there were cases of it, for example, with South Africa and Omicron, there were cases in Nigeria. By the time we put Nigeria on the travel red list, the cases had come through all the way back in October. And also, according to Professor Carl Heneghan of evidence-based medicine, he said that as long as, by the time most cases, I believe it's between a third and half of the cases of COVID throughout the pandemic, by the time that they've been caught, they've reached peak infection anyway. So if you've been out and about mingling, you've already done the damage of transmission. So I'd like to just know if we're going to keep testing, if we're going to do another booster jab offered to people now. Obviously, it's quite costly. I know 800,000 of those AstraZeneca jabs, etc., were binned because of the low take-up of the third booster. So it's still going to be a cost whether or not we just do treatments, jabs, tests, whatever. I'd like to know what more can we do. If you look at the government's report concerning deaths related to COVID for the last week 7 of 2022, the majority of people that died with COVID were triple jabbed. Now, that doesn't say the jab doesn't work, that doesn't say it's not worth it as a preventative measure, but it does say we can't stop COVID. Zero COVID is not a tenable policy, so we need to learn to live with it.
Yes, and I think, to be fair, no political party in the UK is now pursuing a vision of zero COVID. The Labour Party saying that there needs to be some greater surveillance, and I suppose the more libertarian wing of the Tory party saying, well, it's over, we've done it, let's go back to living our lives normally. I suppose there is that distinction, though, between a level of surveillance, as is done randomly by the ONS, a relatively cost-effective measure, versus the mass testing, which, of course, costs that £2 billion a day. That gruesome £37 billion budget total that so often is touted by people who say this is just too much to pay. Many who criticised the £37 billion budget are ironically now criticising the idea that testing may no longer be free. Nigel, do you see a distinction between the ONS surveillance versus the individualised mass testing?
Well, they're both going hand in hand, and it's absolutely right. You can't stop variants getting into the country. But what we need to know is whether they're here or not. And the whole point about testing is that actually gives you an indication that there is a variant around. Now, take the Omicron variant. Fortunately, it wasn't as serious as it turned out to be, although I've just come out of a bout of it last week, and it was quite unpleasant, really. But at the moment, it's even the Omicron variant has now mutated. So we have a new version which is dominant in Northern Ireland. 1 in 5 people in England and Scotland are now testing for this new mutation, and it probably will become the dominant one. And because of the testing, we actually know what is going on. So if you start reducing that, you won't be able to find out what is happening. So, no, it is absolutely right. We can't stop these things getting in, but what we can do is know that they're here, and the only way of doing that is to have proper testing.
So, Connor, in your view, is it that we should have no testing at all, or what would you say is the optimum strategy here? Is there a halfway house that can be met between Rishi Sunak and Sajid Javid?
Well, I think the halfway house is going to be met in hospitals, because currently Omicron is not a severe variant. I'm going to appropriate the words of a man who I'd never thought I'd paraphrase, Bill Gates, in saying that we're blessed that it's a natural vaccine. But if a variant becomes worse, if a lot of people become hospitalised, you're going to be tested in hospital. And might I remind you that most of the tests that we're scrapping are going to be lateral flow tests. They just tell you, with a varying reliability rate, whether you have COVID or not a specific variant. If you go to a hospital, you will probably be a PCR tested, it will be sequenced, and the hospitals themselves will be able to tell if there's a new variant, if it's deadlier, etc. Until then, we've got Omicron, lots of people have antibodies, it seems that the antibody resistance works, just get on with it like any other respiratory virus.
I suppose that is a fair point there. The lateral flow tests, I mean, I found them to be absolutely brilliant. They caught my COVID when I got back from the United States at the end of last year. And without that lateral flow test, actually, because the PCR didn't pick it up in time, I don't think I'd have been isolating. I probably would have infected a lot of people. But it's right that these tests, these lateral flow tests, don't sequence. And in the last figures I saw, they cost $9 billion a year, and that was for year one, before they were being given out at such a rate. Nigel, in your view, do lateral flow tests potentially are they not as useful as those PCRs?
Well, I mean, clearly it's the PCR you need to actually do the sequencing. So it's perfectly true. All the lateral flow is going to tell you is whether or not you have COVID. But this is what comes back then to, this is where these things go hand in hand. What we're talking about now is ending the legal requirement to isolate if you have COVID. That means all of us will have to use our common sense about what we do. But at the moment, without the lateral flow, you won't even know necessarily you've got COVID. You might feel a bit off or whatever. But until you can actually test yourself, you can't find out if you've got it. And if you do have it, the sensible thing to do will be to isolate, as you would have done whether the law mandates it or not. And the problem is, by getting rid of it, those who can afford it, and they'll cost about £30 for a box of 7, those of the people who can afford it, will be able to carry on testing as they are now. Those who can't afford it won't. And so you've got people who are on really low incomes already, because of the cost of living crisis, facing a choice between heating and eating. Now they'll have to make a third choice. Do they try and look after their health by getting some tests in, or do they go without? And the big danger is they'll go without.
Well, let's turn now in our final minute of this conversation to the wider political context here. Of course, the accusation against the Prime Minister is that this has been brought forward a month early due to the political situation he faces. And of course, we've got the Met Police investigation and the local elections running up 5th of May, so not too far ahead in the future. Connor, in your view, how safe is the Prime Minister?
Oh, I believe it's going to be either we've passed the whimper or a bang stage, and now it seems to be very much the whimper. I don't think Partygate is going to have much of an impact on the May elections, actually. I think the major hit jobs the press could have done, I don't think hit jobs isn't the right word, actually. It's fair to excoriate the Prime Minister for locking us in our homes for 2 years and then, parting the night away, etc., because he's the one that set the rules. But I think most people are so unbothered by it. I mean, there's plenty of people that have emailed into GBNews now saying, oh, you're just Boris bashing because they're hoping he gets on with the job. I think actually it's him getting on with the job and not doing a very good job that's going to sink his ship when it comes to May. The cost of living crisis has come in. I was on the breakfast show yesterday talking about how I may not be able to buy a home well into my late 30s at this rate because of the rent rates going up, because of a historic low in houses on the market in December. £693 is about to hit in April per household for energy bills on average. It might be higher. So if people see that about a month before they're electing, maybe there might be another Conservative MP in my constituency, I think most of them, like the Conservative voters in Bexley in my constituency, won't even vote at all. They'll probably just stay home, and you'll see sweeping victories for various different parties in the local constituencies.
Does seem that is a pertinent risk for the Prime Minister. Final word to you, Nigel. May elections, how safe is the Prime Minister?
I don't think it's safe at all. I'm not sure he'll even make it to May. And certainly the Partygate will have an effect on that. I mean, at the end of the day, the Prime Minister's future is in the hands of his own MPs. They will decide whether they're going to oust him. And I think that the next stage is going to be when the police come back and say whether or not the PM's getting a £100 fine.